So what we're doing is holding that tongue up at the top like you're about to, and all we're going to do is get in that position and hold and tighten the muscles around that. So whenever we do that, we're tightening a lot of these deeper intrinsic muscles that really start to kind of stabilize the jaw. Another treatment that is really effective that we use a lot is something called high-intensity laser. That's what you're seeing here. We use a high-intensity laser that penetrates upwards of like 5 inches in through the tissues. Hey everyone, Derrick Hines here. Welcome to the podcast where I'll share with you the patterns, insights, research, and technologies that we use in my own pain and performance practice to help people improve their health, speed their healing, and increase their longevity. Thanks for listening. I hope you enjoy it. Good day, my friends. So today, if you know somebody who has suffered with headaches, who has had tension issues, eye issues, or jaw pain, we're going to go through how all of this interrelates with the head, the neck, and the jaw. So whether it's TMJ, muscle spasms, tension type headaches, we're going to do kind of a deep dive on this whole area of the body and talk about how all of those can affect each other, how that can cause TMD, temporomandibular dysfunction, so TMJ dysfunction. I know a lot of people call it TMJ, but that's just the joint. There's got to be a dysfunction to it because just I have TMJ. Yeah, you have too. But so we're going to break all of this down and what's the connection between these things. So let's start with a little bit of kind of a review of the TMJ and the anatomy here. So our temporomandibular joint is a hinge joint that kind of is the mandible that is attached onto the temporal bone, onto the skull. And it allows for us to open and close and speak and breathe and all those fun things that we all like to do. There's a disc complex that basically allows a little articular disc that cushions the movement and makes really smooth motions right there. So if we're looking at this, what you see is that we have this articular disc, the head of the mandible, we have the joint capsule through there, we have this lateral pterygoid muscle, and we also have a medial pterygoid that's not pictured on here. And so when we go to move this through the motion, that disc needs to stay in contact or on top of the condyle, on top of the head of the mandible that you see in this picture. So we need good motion. And when we go to open really wide, the head of the mandible glides forward. And so you see that the muscle communication has to be good because the lateral pterygoid is what actually slides the disc forward as we open our jaw to keep that articular disc in line, in place above the head of the mandible so that we don't have inflammation, friction, and pain that comes from some of that stuff. So that helps for us to kind of see what's going on there. If we look at some of the kind of muscles attached to it, on top of the lateral pterygoid, we have a medial pterygoid that lies a little bit deeper. It helps us to kind of elevate the mandible and associated with like grinding motions in there. The masseter is the big muscle on the sides that if you ever like just massage the sides of your jaw, that's usually the masseter, and that's what a lot of people think of as like joint tightness in there, or muscle tightness rather. And then we also have your temporalis. That's up on the temples. And that has a big job in closing the jaw, and it does help to kind of retract. So if you really bite down, you'll pull your jaw back, and that's your temporalis muscle. That is a very important part of the referral patterns of some of these, and we'll go through that here in just a second. So if we look at the nerves that communicate with those, you have a few main nerves that talk to these things. You have your trigeminal nerve. That's a cranial nerve, comes straight from the brain stem and goes kind of through the brain to supply the sensation to your face and controls the muscles used for chewing. So it has basically 3 branches. So it comes through and it splits off. So it has like the ophthalmic branch that supplies like the head and up around the eye, the maxillary branch, which crosses kind of the mid part, and the mandibular branch, which covers the mandible, right? So that is the main nerve that we need to look at and address if somebody's having problems with this. And then you also have another branch of your auriculotemporal nerve that comes up from the side right here, right around the TMJ. And that supplies sensation to this area specifically, to the TMJ, and the surrounding areas kind of around the ear there. So very, very important part of this that does help to kind of show what's going on there and tell your brain what's happening here. So if we look at some of that in kind of a picture, so you see the main trunk right there as it kind of comes through here is parts of the trigeminal nerve that kind of comes through and then will spread out. You have quite a bit of different nerve branches that'll go out and supply specific parts of the muscle communication and the sensory inputs from the jaw and the muscles of the temporalis, of the masseter, of the deeper pterygoid muscles. So this kind of gives us a good little overview of what we're looking at in terms of nerve communication from all of the muscles around the TMJ into the brain there. So hopefully that helps you kind of have a decent understanding of like what the communication is. So there's an area in the brain called your trigeminal cervical nucleus. I know that sounds like a very big word. that nucleus, it takes the information from the trigeminal nerve, from all of this, and from the cervical joints, so from the upper part of the neck. And it's like one area of the brain receives all the inputs right there and tries to decide where the problem is coming from. And what this creates is this mechanism where if I have dysfunction coming from the trigeminal nerve, from the muscles around the TMJ, around the face that go and light up that area of the brain, then a lot of times what you'll notice is that it upregulates and tries to protect us. And so we'll feel very stiff and tightness in the neck, and we'll feel a lot of spasticity there. The joints will be inflamed or dysfunctional in the neck. And the reverse is also true. If I've got dysfunction at the neck and those nerves are trying to tell the brain, hey, something's tight, something's inflamed, something's irritated, it'll light up that area of the brain, and in that kind of protection response, we'll end up upregulating the issues around, or the structures around the TMJ. And so that's something that we really see being very important for people, is that there's a feedback mechanism on both sides of the coin here. The jaw can cause issues at the neck can cause issues at the jaw and the face. The head can affect both of those, and all of these get kind of processed in the same area of the brain. So that's where we see a lot of our patients who have TMJ dysfunction and headaches, or headaches that's affecting TMJ. So when we're looking at this for us, if we're treating somebody who's got headaches or they've got TMD, they've got jaw pain, we always want to look at the other structures, because I've had many patients who come in and they've got TMD, and we start looking at them and they've got a problem at the upper neck that is perpetuating the issues at the jaw. And so if we resolve the neck issues, we correct some joint function, we reduce muscle tension and spasms, we calm the nerves down from there, and all of their jaw pain goes away. And the flip side is also true. I've seen many people who had recurring neck issues that when we started looking, they were having some jaw mobility issues. And when we resolve that and we treat the neck, that it makes it much easier for the body to get into a permanent resolution of those symptoms. So when we look at it, all of these create one system. And that's really what I want you to understand, is that it is a combination system. So if you look at the prevalence of TMD, so TMJ disorders, they affect about 10 million people in the US, more common in women. If you add in headaches to this number, because I think they are very, very related, that number balloons by a factor of 10. So people who are affected with TMJ or headaches is in the 100 million category. So when we look at what's causing TMJ dysfunction, TMD, or headaches, there's a number of things that can be causing this. So initially what we would look at is basically grinding or clenching. That's going to come from either a mechanical stimulus where the muscles are squeezing so tight because they're guarding, or a nerve stimulus where the nerve's telling the muscle to tighten up to kind of protect the joint right there. So either one of these will cause significant compression through the TMJ and into the structures around the neurovascular tissue, so the nerve and blood flow that leads to that. Sometimes we'll see people who end up with a jaw injury. This will happen after an accident or something that can cause some dysfunction there in the jaw and in the upper neck. Certainly we see that over a long period of time, those things and malalignment can start to lead to a breakdown of the joint and the capsule around the joint that keeps it in a good position. And muscle tension over time just starts to restrict blood flow to all the structures through there. And so when we're looking at that knowing that the multiple factors can be involved around the jaw, around the upper neck, and the muscles related to both of those becomes quite important, because we need to know where to focus our treatment. Are we treating all of those? Is there a lead domino for our patients that we can get into a better kind of treatment program? So I'm going to break down a few of the treatments for you whenever we're looking at conservative treatment and regenerative therapy for TMJ dysfunction. So if we're looking at it, initially what you would see is something like dry needling is a huge treatment option for the kind of healing mechanism. So if we're going to go through that, what you would see is using like the tiny little monofilament needles. Let's see if I can show some of that to you. So the tiny little monofilament needles that you see right here that we would use to go in, and we would treat around the actual joint right there where that disc is. And what that's going to do is stimulate healing in those tissues. That's going to help to reduce inflammation and actually change the nerve communication to the brain from that area. What you'll also see is that we're going to treat the muscles related to that. So you would see us treating, in this case, the masseter, the medial and lateral pterygoid, and the temporalis muscle. And these are kind of your basics, but we're also going to feel through all of those structures to find where are the trigger points, where's the reactive tissue, is there some knots in all of this, and release that so we can restore normal motion in the muscles of the jaw, the head, and the neck. And that creates a really positive treatment effect. Dry needling has been studied with TMJ, multiple studies looking at its effectiveness, and it is very effective in reducing pain, in stimulating healing, and in correcting joint motion. We'll tag those studies in the comments. Another treatment that is really effective that we use a lot is something called high-intensity laser. So that's what you're seeing here. We use a high-intensity laser that penetrates upwards of like 5 inches in through the tissues, and all of our tissues, all our cells have a little photoreceptor on them. And that photoreceptor actually can increase or decrease the cell response. When that photoreceptor gets activated, our cells, our mitochondria, if you remember what, like 6th grade science, the powerhouse of the cell, starts to produce a lot of energy. And that ATP energy starts to really improve the body's ability to heal that, because it has a lot of extra energy to go in and remove inflammation, repair healthy tissue, clear out damaged tissue, all of the above. So this becomes a very deep, penetrating regenerative therapy whenever we're combining the needling and the high-intensity laser. Those two become very, very important whenever you are trying to actually regenerate healthy muscles, tendon attachments, disc, and capsule of the TMJ. So very helpful if we are going through the treatment process to actually get in there and stimulate true healing on a cellular level. Now, we'll also do a lot of manual therapy stuff where you get in and you're using hands-on techniques to get the joint of the jaw moving correctly. There's multiple muscles attached on both sides. As we kind of look at that, you have the articular disc on both sides, both connected to muscles, and we're trying to move that whole complex in concert together from left and right. So as something that seems so easy, it's just this hinge joint, it needs to go together. It's very easy for us to kind of lose coordination there. And so when we're working on that, we need to use a lot of like hands-on and exercise techniques to reprogram that motion so that everything is moving really well together and we're not having excessive pain or twisting or lateral motion with that, because that starts to put more pressure on the structures on one side versus the other, creating inflammation. And that leads us down that kind of destructive pathway where we start having some problems. So that's kind of, along with postural exercises and neck exercises, can be very helpful. So we'll go through a little bit kind of the main treatment aspect that we want to go through with this for home use, but one of them is just stretching the upper neck, and we use like a little strap stretch for that. We want to do some exercises to strengthen the stabilizer muscles inside the jaw and to work on our posture, because we've talked about, if you kind of fall forward and you get into this kind of compressed position, what you're doing is putting a lot of pressure on the structures in the upper neck, but you're also putting dysfunction in the jaw where the muscles, we slightly kind of fall forward, and the muscles that would typically function to open and close the jaw, I think I have a little snap of this that we can show you, that would normally open or close the jaw, can actually create some compression in there. And so for a lot of these, we need to work on posture as well. And if we get the posture better, then we can improve the position of the jaw. So if I show you this, if y'all are not watching this, I'm going to try and explain this here. So we're looking at kind of what happens whenever the head goes forward. This is one of those podcast episodes I would definitely recommend you go back and watch the YouTube video, just because I'm sharing some of the pictures here that kind of bring this all together. So what happens is when we slide forward, the sternocleidomastoid muscle, the muscle along the side of your head and neck, starts to compress the neck, starts to compress the jaw. That also causes us to lean forward. We're compressing the structures in the neck, which increase the chance that we upregulate the muscles in the jaw because of that trigeminocervical nucleus. But also a lot of the muscles that would squeeze the jaw back start to tighten because of the position of the head there. And so what ends up happening is we start to compress the back of the TMJ, the back of the joint. And behind that, you have a lot of neurovascular tissue that can create significant inflammation and pain. And so in these situations, if all we do is get the pressure off of that and get the neck in a good position, you'll see a lot of improvements in the pain that somebody's feeling in the jaw itself. So hopefully that makes a little bit of sense. If you're just listening to this, Google posture and TMJ dysfunction, and you'll see some of the pictures that show what's happening at the jaw whenever we're sitting with bad posture. So That's our treatment approach. That's what you're going to do to try and fix the dysfunction there. We need to correct the joints of the upper neck, correct the joints of the jaw. We need to correct the nerves of the upper neck, the nerves leading to the jaw, and we need to make sure that we are correcting the muscles of both of those as well. So the joints of both, the muscles of both, the nerve of both. And when we fix that, the chance that somebody still has a dysfunction of the temporomandibular joint goes away. It's one of the few areas in the body where we say, look, if you do this right, you're not going to have pain there. It works so well, especially whenever we're bringing in some of these really effective treatments in terms of getting in there to stimulate muscle changes and nerve changes, and you're using some hands-on technique to get the joint moving really well, and we're given some of the exercises to do it. So one of the things I want to show you is a couple of the exercises. So we're going to run through these and kind of take a look at what they're doing with it. So let's pull some of these up. So the first one, if you're listening to this, is going to be holding the tongue at the top, and you're going to be doing a cluck. So what we're doing is holding that tongue up at the top like you're about to, and all we're going to do is get in that position and hold and tighten the muscles around that. So whenever we do that, we're tightening a lot of these deeper intrinsic muscles that really start to kind of stabilize the jaw. And we're going to do that, and we're going to hold that for a good count, for a deep breath in and a deep breath out, and we're going to repeat that 6 times. So we're doing 6 of those. The next thing we're going to do is we're going to hold the tongue on the roof of the mouth and open as wide as we can comfortably and stay in alignment. This is a really good one to do in front of a mirror. So you're going to hold it at the top of your mouth, open and close, and try to keep that jaw in good alignment. We're going to do that 6 times, nice and slow. We're not rushing through this. Then the next thing we're going through is we're doing isometric contractions. So that means you're not going to be moving. And we're going to do a number of different exercises with that. So what you're going to do with it is you're going to put the hand underneath the chin, and you're going to open. Hold that for about 2 to 3 seconds and relax. And we're going to do that one 6 times. 3. So you're just stopping your jaw. If you're listening to this, you're just stopping your jaw from opening while you have your kind of hand underneath, and you're just pushing into your hand. Then what I'm going to do is I'm going to try and push my jaw to the left, and don't let that happen. Hold that for about 2 to 3 seconds and repeat that 6 times. Then pull the jaw to the right. Don't let it happen. So you're pushing against yourself with that. Hold that for 2 to 3 seconds. Repeat that one 6 times. And then I'm going to push my jaw out forward. And don't let it get pushed back in. And I'm going to hold that for 2 to 3 seconds. And then I'm going to try and open my jaw. So I'm just kind of pulling down on the chin. Don't let it open. So I'm holding it right there, kind of teeth just separated. And I'm going to hold that for 2 to 3 seconds and repeat that one 6 times. So we're running through, pushing the jaw open, trying to open the jaw. Isometrically resist, do 6 of them. Jaw to the left, resist. Hold that 6 times, jaw to the right, and then closing and pushing forward. So those are the motions that we're going to do isometrically. Then the next thing that we're going to do in our scenario is something called a strap stretch. And that strap stretch will help quite a bit to get the upper neck moving really well. So whenever we're trying to do that, we use a towel or a strap and I'm going to show y'all this that you can understand what I'm talking about. So we use this strap, and basically what we're doing is letting the towel or the strap run along the base of the neck or the base of the skull, and we're going to hold on to it with our top hand. This is really hard for me to explain, so make sure you go watch this one. And you're using that towel to help pull around, so it's getting the joints of the upper neck moving. This is much different than just stretching the neck one way or another. If you have that pressure of the towel pushing on those joints and muscles, it really changes and improves the biomechanics of it where the joints are moving better. So this is really a good one to add in. If you've got neck pain, if you've got headaches or anything like that, very, very helpful for you to do this to get the joints and muscles moving really, really well. So we're going to do that. We're doing turn all the way, give it just a quick little hold, and then we're coming back straight. We're going to do that 10 times in each direction. And then the last thing we're going to do is loosen up the upper back. So we can do hands behind the neck. We're going to rock all the way back, and then we're coming back up. All the way back and come back up. We call this a thoracic extension. So that's a really good one to start opening up that posture and reversing that kind of hunched posture there. And we're going to squeeze the shoulder blades back together. Squeeze the shoulder blades back together. This is kind of just mimicking a row just to turn on those postural muscles in there. And that's the let's call it workout program that you're going to go through to improve the function of everything around the neck, the jaw, and that kind of head complex there. If you run through those, this is something that we tell people to do every day while you're kind of dealing with jaw pain. Start working through that to kind of start reprogramming how all of this stuff moves. And it does really well if you can go through that. Do it every day. It's an easy thing to do in front of a mirror. So we tell people pair it with brushing your teeth. Go through those movements to help improve the muscle activation in there and the alignment at the same time. If you're doing it in front of a mirror, you're really trying to, when you do the opening and closing with the tongue on the roof of your mouth, you're really working on keeping the jaw as aligned as you possibly can. If you have a side that you have a difficult time firing those muscles, we're trying to really notice that in a mirror and activate those muscles much better. So, I do tell people in the beginning, if you have some pain in here, then what you want to do is avoid like very hard foods. It's quite easy for you to say, I'm going to chew on the other side. It just takes one time for you to pop that back to the side that's hurting you because it's so automatic when you're chewing things. So for a little while, go towards soft foods. Avoid excessive jaw motions. So you really want to not be like over opening and clenching. Start to become aware of clenching it. One of the things that I think is very helpful for people to understand is that I find that there is a stress component with clenching. There can be that kind of fight or flight component where if I'm ready for fight, I'm ready. If I'm ready to kind of flee, I'm tensing up. And that usually starts in the jaw. And so if you have a lot of tension in your jaw, then what we can do is start to work on awareness and relaxation of that. It's almost a meditation where you're just trying to shut down all the muscles of the face and the jaw as much as you can while you're breathing in and out through your nose. This is a very helpful exercise for somebody who just is always kind of clenched in there. I have had a lot of patients who started taking ashwagandha as a kind of stress reliever and found that their jaw pain and tension decreased. And what we see with that is it's just relaxing that fight or flight response. And so you're getting much better relaxation in those muscles and it doesn't hurt quite as much. So those are things that you can do if you're like, my jaw is always tensed. start to try and do some basically meditation while you're focusing on the muscles in the neck and the jaw, relaxing deeper and deeper as you kind of breathe. Set 5 minutes and just do some breathing while you do that. And make sure you're getting good treatment. So if you're listening to this and you made it this far, if you're watching this, it's one of the things that works so well if we treat it correctly. So I'd say, find a practitioner who is willing and able to do a really good assessment of the jaw, the upper neck, all of the muscles and nerves attached to that, and find out what's going on in there. The other thing that we need to make sure is we've got to get to these deeper structures. It's really hard to do that hands-on without doing some version of medical needling. So find a medical dry needling practitioner who can get to all the structures, all the nerves, and the muscles that are related to these structures so they can stimulate healing, release the trigger points, and restore normal mechanics in there. And then for you, make sure that we're starting to work through some of these exercises. If you can, and it's not painful right now, I think I would say start with the exercise. And if you need further help, contact a practitioner in there. The little kind of modified Rockabato exercises that we went through, the resistance in there that you see, doing the opening and closing, doing the little cluck exercise there, do the strap stretch, do some thoracic extension and squeeze those shoulder blades together. Those things work tremendously well. I'm going to put all those in the comment section of exactly what to do. So just go to the description of this podcast and you'll see all of the exercises on there. But if you need more than that, then what we do is we bring in high-intensity laser therapy and peptide therapy in a lot of cases because we're trying to rebuild the integrity of the joint capsule and the disc. And in that regenerative therapy component where you're doing a peptide, you're doing dry needling, and you're doing laser, you're giving the body all the things it needs to repair and regrow healthy tissue in that area so that you now have a healthier, stronger joint capsule that's not letting that jaw kind of move around excessively. Or you have a more healthy and robust articular disc, so we're kind of restoring some of the space there so the jaw can move well. So in those more severe cases, we'll bring regenerative therapy in and really kind of move the needle on how healthy the actual tissue is in that area. So that's all my spill on kind of TMJ and upper neck and headaches. I hope some of that makes sense. This is definitely one of those where I think the video works. And if you are listening to a lot of these podcasts, we put all of these out on YouTube and it just hits a little bit different if you're kind of watching the conversation. So this is a solo episode. Let me know if you like these kind of deep dives into specific kind of treatment areas. I'd love to get some feedback on it. And we can kind of do more of these if this is something that y'all appreciate or get some value from. So with that, we have an amazing lineup coming up. This is the best guest lineup that we have had on the Pain and Performance podcast, and that's saying a lot. We've had some absolutely incredible people on here. Please subscribe and share the show and give us a review. That helps all these guests find us, and whenever we are reaching out to some of these really big name people and they go and they see all the 5-star reviews, they're like, yes, I want to work with these people and have a conversation and get this information out there. So that's my ask. We do a lot of these, and that'll take you a few seconds on whichever app you're on. If you just kind of scroll down to the review section, you can often see where you can kind of give a rating and leave a review. So I hope y'all are getting some value out of this. And remember, do that one thing to get a little bit healthier today. Have a great day, everybody.